Welcome everyone to today's webinar, Transforming Healthcare Staffing, Effective Strategies for Managing Locum Tenens, Workforce Development, and Contingent Labor. On behalf of Becker's Healthcare, thank you so much for joining us. Before we get going here, I'm going to cover a few quick housekeeping instructions. During today's panel discussion, we certainly welcome any comments or questions. You can submit those throughout the webinar by typing them in the Q&A box you see on your screen. We'll try to make time at the end of today's webinar to take some of those questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you have trouble with your audio or video, please try refreshing your browser. That often does the trick there, but you can also submit any technical questions into the Q&A box. We've got folks on the back end who are available to help out with that. So with that, we're pleased to welcome this outstanding panel of leaders. I'm going to tap on each of these folks to introduce themselves by sharing a bit about their professional background and organization. Francie, I'm going to tap on you to get us going there.
Excellent. Good morning, everyone. My name is Francie Barnett. I work for CommonSpirit Health, and I am the System Director and the Operational Lead over our National Locums Program that we implemented about 4 years ago, and also the lead over our internal locum agency, CommonSpirit Locum and Traveler Network.
Excellent. Great to have you, Francie. Looking forward to hearing more about the work you're doing. Janet, let's meet you.
Hi, yes, I'm Janet Pilchard. I'm Executive Director of Provider Recruitment and Locums at Wellstar Health System out of Marietta, Georgia. I've been in this business for more years than I'll ever admit, and I've been working with locums since the early 2000s. So excited to be here today.
Excited to have you. Excited to hear more. Thank you, Janet. And Jana, let's meet you.
Hi, good morning. My name is Jana Reed, and I currently serve as the Vice President of Recruitment for AMN Locums Services. I have been with the organization for 20 plus years in a variety of roles within recruitment and delivery, and now running the AMN Locums delivery side.
Have your perspective here as well. And Pat, let's meet you.
Thanks. Hi, everybody. I'm Pat McCall. I'm the Chief Growth Officer at AMN Healthcare, and my background is in human capital and human capital technology. And I was most recently, prior to AMN, the Chief Sales Officer at Randstad, which is a global staffing organization based out of the Netherlands.
Oh, excellent to have you as well. Let's dive right in here. And to begin, I want to hear how at the organizations here at the health systems and from AMN's perspective, from a partner perspective, or what you're seeing in your own organization, how are locum tenens really, these providers, how does this model help address issues of employee burnout and turnover in recent years? We'd love to hear some specific examples. Pat, I'm going to actually tap on you to get us going here. And again, thinking about this from the perspective of AMN with your own teams, and also but the providers you work with, the health systems you work with as well. Would love to hear your assessment there.
Yeah, thanks. Certainly, from our perspective, it's about managing the load that physicians are under. And certainly that comes from effective workforce mix modeling. You're starting to see organizations engage in a lot of new approaches, some of which were also utilized to handle the nursing shortage as well. So you saw internal float pools, now you're seeing PRN. So you're seeing new innovative approaches, but a lot of them are focused around mixed modeling of the workforce and managing the load that physicians have.
Yeah, really trying to try different things, right? To really help relieve some of that burden that's been pretty long-standing, right? This is the level of burden here, while certainly made very clear to folks during the pandemic, it's certainly acute, but this has been going on for a while, correct, Pat?
Yeah, it has, Brian, and we're obviously facing a systemic physician shortage. In the next several years, we're going to have, we're going to be flirting with shortage levels that are well over 100,000 nationwide. So this is a a very clear and present issue, and something that we all need to work together to alleviate some of those load factors that folks are experiencing.
Jana, what would you add here to your colleagues' comments?
I completely agree. I think, over time it has shifted with the shortage. We are still very much tapped on to help support from supplemental care, just helping to alleviate for call coverage, helping to cover for vacations, helping to permanently staff while healthcare systems recruit for permanent providers. But that has changed over the years. That too still is a constant within how they utilize locums. But to Pat's point, there are innovative ways that they are looking to utilize locums to help just alleviate the physician shortage across the board.
Yeah, it goes back to that innovation piece, trying new stuff. And would love to Francie, to hear from you next as a locums leader in a major health system. How's this showing up for you all in terms of leveraging these models, this innovation, this new staff to try to address that burnout issue that's been so pervasive and so long lasting in healthcare?
Mm-hmm. Absolutely, as Jana and Pat both mentioned, at CommonSpirit Health, it's a significant ongoing issue is physician and provider burnout, which is a lot of it's based on the shortage of physicians. And what we've been able to do is utilize the temporary or locum providers to kind of fill that gap, to allow our permanent providers to have time off and that necessary time off that they need to kind of regroup. And so that's one of our strategies around our locums program, is supporting our employed physicians and giving them that time off that they need. So, and we continue to do that with our locum strategy.
And Francie, have you seen sort of, a change in expectations too among physicians in terms of what they want in terms of flexibility and time off? I think it's been noted among sort of nurses returning to the workforce, or even boomerang nurses, as they're sometimes called, are coming back with changing expectations. Is that shown up for physicians as well?
Absolutely. I think the physicians entering in the workforce, and I work more in the lane of locums rather than perm recruitment, but doing a lot of crossover work with that right now. But I think physicians are coming into the market wanting that work-life balance, and they want flexibility in their schedules. And I think there is a shift amongst those permanent physicians. And as a health system, we have to adapt to that change and be a little bit more flexible and be able to support them with the needs that they have coming into the workforce.
Yeah, and locums as a potential lever to do that, right?
Absolutely. Definitely, it's been able to really. I would say in the perfect world, locums would be a last resort for any type of staffing. But for us at CommonSpirit, it's been more of a strategic placement, is to support not only our physicians that are working, but also those open gaps and schedules in our clinics and our hospitals. And so we view locums more of a strategy and a need, and built a program around that with vendor partners that we truly are partners with. And the outcomes have been wonderful.
Excellent. I appreciate you sharing some of that, and maybe get into more specifics later as we move through the conversation. But Janet, I want to give you an opportunity to weigh in here as well.
Sure. I echo what Francie said about, there's the physician burnout that is occurring in the country right now is continuing to escalate with the shortage of physicians on a national basis. We need to provide care to our communities, and utilizing our locums partners as care for our communities is the best thing that we can do right now, because it provides care, but it also provides an opportunity for our physicians to take a break, to relax, to have some time away so that they can rejuvenate. Because locums, a lot of folks say, oh my goodness, we're getting locums, but you have to use them strategically and really utilize their services to the best for the health system, for the community. So getting a strong partner is absolutely instrumental to success.
Yeah, and this physician experience, this physician combating physician burnout. I mean, it's not unrelated to the patient experience as well, right? These are interconnected things here, so it's solving for both challenges, correct?
Absolutely, it is. Absolutely. As our nation is aging, there's more of a demand for healthcare, for services. And so we have to meet those. And as you alluded to earlier, a little bit of that newer generation of physicians coming in right now, they have said, I'm not going to work the exorbitant long hours that I see my predecessors working. And, and rightfully so, they don't want the burnout. They need to maintain their lifestyles. They have to have that work-life balance.
Thank you for that, Janet. I want to shift a little bit now because I think it's important to get to this portion of the conversation early, which is thinking about labor costs here. So hospital labor costs continue to grow. The numbers I have in front of me suggest labor accounting for 84% of total expenses in the first quarter of 2024. So I'd be curious to hear from folks, how has reducing dependence on locum tenens providers played a role in reducing overall labor costs and achieving sustainable staffing at your organizations? What tools or strategies have you deployed? What would you recommend to folks tuning in right now? Janet, I'm going to give this one to you first.
So I don't necessarily think it is eliminating the use of locums. I think it's more around tools and strategy to really look at controlling cost through containment. So when you look at tools like a VMS platform, or you look at a managed services program, which allows clients to really get a consolidated look at where that spend comes from, that's critical. A lot of systems can be fragmented and not really even understand what their locums utilization or locums spend is. And so VMS tools, managed service programs, opportunities for a client to really get a 360 look at where that contingent labor cost is. Really understanding that helps them to be able to get better control of it, which then allows them to control the cost a little bit better. Not necessarily cutting out locums, but just understanding where that utilization is becomes very critical, especially in systems like Francie's at CommonSpirit or Janet's at Wellstar, which are massive systems which utilize in a very large way.
Yeah, it goes back to, I appreciate that, Janet. It goes back to that strategic part, right? Not necessarily cutting it, but where and how are you using locums, correct? Excellent. Janet, does what Jana just shared resonate with you and what you're seeing at Wellstar?
Absolutely, it does. We're very strategic about our utilization of locums. A lot of vetting goes into the request of a locums. Do we need it? Have we exhausted every other opportunity to provide care? And so we're very cautious about it, but also, you recognize truly that you not being able to provide the care is not good. And so the locums have been able to help us continue that care. But you've got to be so strategic about the usage, especially the cost. It really is high. So
yeah, you've got to leverage that investment as intelligently as possible, correct?
Absolutely, you're correct on that. Absolutely.
Yeah. Francie, can you weigh in here as well?
I'm sure. I mean, we've seen an increase of locum utilization in our hospitals. And obviously that is not where we want the trend to go, but we've also acquired additional health systems that have needed that support. I would say though that one thing that we do with our national program is something that was recently rolled out, is to make sure that we have a perm position for every locum job that's posted, that we have a permanent position posted as well. So very much in alignment with the perm division to make sure that we are working more harmoniously together rather than in separate lanes. And I think one thing for us, we have a very strategic system in place where we use a VMS tool. And then we have partnered with vendors that are very collaborative, and we have a very high level of partnership. I think having those vendor partnerships are so important to sourcing locums, the type, what you need, the details behind those jobs, but then also having software to track everything that you do. And so we're able to report out, I report out monthly on utilization and spend for every single facility specialty. And so it gives so much insight of decisions that we make when you have that level of detail on locums that are currently being used, and then build strategies around that.
Yeah. Thank you, Francie. Pat, I want to come to you now. Francie referenced VMS tools. Jen, your colleague Janet did as well. Can you go a little bit deeper on that front specifically for us?
Sorry, Brian, hopefully you can hear me. Had a little glitch in sound here. Yes, so with respect to VMS tools, I mean, you see obviously usage of locums going up, and that also means that there's an opportunity to drive greater transparency and controls around the usage of locums, and also rationalizing the use, but not only that, but also ensuring that you have the right suppliers, as Francie and Janet had mentioned. With locums in particular, we see that there are a number of organizations that are sort of attacking this problem with a VMS or an MSP. Typically, they're using neutral order distribution, if that makes sense. So they're utilizing all of their suppliers on a relatively equal basis, and they tend to use a tiered or a preferred partner, as Francie had mentioned. So we are seeing more prevalence of this. A year ago, we didn't see this much. And now we're also seeing that organizations have the desire to integrate locums usage as a part of their overall contingent workforce program as well. So there's a lot more thinking about this, not only from a system perspective, but also a programmatic perspective, and looking at contingent labor holistically across systems.
Yeah, very interesting, Pat. Thank you. Jana, one more check-in with you here on the VMS tools. I think you flagged it first for us in this portion of the conversation. Want to make sure you got another chance to weigh in if there was more you wanted to build on after Pat.
Yeah, not necessarily with the actual VMS platforms themselves, but more of the strategy, as Francie alluded to earlier. As you know, AMN, over the course of the last several years, we really consolidated our organization under that one AMN brand strategy. And that is very much in relation to what the clients are asking for. So as we are going into clients and trying to meet them where they are, one of those is that locums permanent solution that Francie mentioned. And so being able to have that holistically under one umbrella, so we understand where there is locums utilization and they're also permanently recruiting, we too can build an internal strategy around how we operationalize that to help support that through both avenues of labor for them. And so that is very much a strategic approach that we are taking in conjunction with the healthcare systems to make sure that we're not just able to support or plug one hole, but we're actually assisting here while we're also working in another avenue to try to help support from a permanent perspective as well. So that is very much a part of the strategy in addition to the VMS platforms.
That's really fascinating to think about AMN as sort of structuring their organization in a way that actually reflects and meets the needs of your partners. That's really fascinating, Janet. Thank you for flagging that. I want to shift gears just slightly here to focus on telehealth, just because, of course, telehealth services and virtual care, broadly speaking, are really at the forefront of efforts to try to broaden patient access and improve care efficiency. But of course, there's a locum tenens component here as well. So curious to hear about how the growth of telehealth services can complement the use of locum tenens providers and enhance patient care delivery overall. Janet, I believe Wellstar's doing quite a lot in this space. Can you chime in here first?
Sure. We have been utilizing virtual care on our behavioral health side for quite a bit. And also, in the teleneurology world, et cetera. And so having that option for our patients has helped us really provide care faster and really get that real-time care to patients without having to hold and wait for the physician to come in and see. But having that virtual option is tremendous, and we are in the process right now of developing other virtual digital health opportunities. So it's capitalizing on a market where folks need the care, and it's they need it now. And so by being able to offer that, we're able to really meet the demands of our communities.
Great work. I appreciate you sharing that, Janet. Jana, does that sort of line up with what you see across AMN's partners as well, Janet's experience?
Absolutely. Not only does it support their community and their patients, it's also another way in which it helps support that burnout and turnover from the physician's perspective. So improving that work-life balance, optimizing schedules, being able to reduce commute times into the office, better patient experience, all of those things also help to support the physician side of that. From a locums perspective, we do get the ask in all of those areas that Janet mentioned, teleradiology, the behavioral health space, teleneuro. Those are all very big requests when it comes to telehealth services for us.
Thank you, Jana. Pat, anything to hook on to your colleagues' comments there?
Yeah, maybe the one thing I might add, Brian, is that, telehealth, I mean, one of the reasons I think there's a lot of promise in telehealth is obviously it's not time and place bound, and it can extend the range of the patient referral base and potentially drive more patients who may not have sought care or sought it elsewhere into the health system's specialty care complex. So it's that measure of flexibility extends care, and it also increases the patient base as well. And then with respect to locums, a number of locums, a lot of the providers that we see are more comfortable in these hybrid care situations. They tend to skew to being more.
We may have lost Pat there for a bit. If we did, we'll give him, if he's able to come back, I'll give him another chance to weigh in here and get him up to speed on the conversation. But in the meantime, Francie, I wanted to give you some space here to chime in as well.
Yeah, I mean, telehealth is such a wonderful option to have. I mean, we do have a telehealth division within our organization, and we do source locums that work through telehealth. And I always say it's always an option, especially for the rural markets. So it's kind of like one of the tools in our toolkits that we can offer for those, especially those hard to fill jobs. But also Jana and Janet, I agree with everything they said as well.
Yeah, definitely a handy tool to have, and more to come in terms of its development, I'm sure, for rural communities, especially, as sort of, I believe efforts are underway in many different areas to increase broadband access and that stuff as well. Are you optimistic about that change as well, Francie?
Absolutely. I think it's a great option with the physician shortage. Like we all know, it's happening. It's been going on for years, as you mentioned at the beginning of the hour. It's an option that we have available. I just think it's, you need to have a process in place too to make it work very efficiently as well. And so I think specifically for rural markets, it's a wonderful option.
Yeah. And Francie, I want to come now to sort of something you touched on or alluded to earlier comments in terms of finding this harmony between permanent physicians and locum tenens. It certainly has come up. Can you talk a little bit about how you navigate that? How do you prioritizing the hiring of permanent physicians? Where are you not trying to rely on locum tenens as much? Where are you plugging them in? Can you get into some specific examples here of cost savings or other outcomes you've achieved in your efforts to, as Jana and others have talked about, really finding that strategic balance, right? Can you get into some specifics?
Absolutely. I mean, I think the locum utilization, if you look at the trends, it's not sustainable. I know what we've done with CommonSpirit is I work very closely with our permanent recruitment division on trying to make a lot of alignments between, if there's a locum position, there should be a perm position. And what are we doing together to help source that position? And Jana, had mentioned too that we are exploring a locums to perm option, a true locums to perm option. And what does that look like? And we're going to be piloting that here very soon, and trying to create that harmony, like you said, between permanent recruitment and locums. I think also having data is for us as an organization has been a true game changer, is understanding, when you have data and metrics around the specialties you're using in the facilities, how can you maybe partner with another facility and use that provider? How can we reduce spend of the locums? And so we continue to go down that path. But I think our partnership with perm recruitment is here to stay. And I think we have to be, as an organization, we have to be very mindful of that and build strategy around that.
Yeah, thank you for sharing that, Francie. Janet, coming to you now, can you break this down a bit for how you're approaching this at Wellstar, and what outcomes you've achieved in terms of trying to strike that strategic balance that we've been talking about throughout the conversation today?
Absolutely, and Francie said it really well. You've got to have that permanent recruitment going on at the same side. Both permanent and locums lives in my world, and so it's a balance. As we get a request to add a new locums, we're looking over on the perm side saying, okay, what do we have going? Where are we? And bringing in that locums does help, because when we do get that permanent physician coming in to interview, they're coming into a practice where the physicians in that practice are going, hey, Wellstar's helping us, manage the service. We're able to cover. We're not, our work-life balance is being okay. And so when that permanent candidate comes in to interview, they're getting a really good view of how things are and how they will work once they're hired and that locums position goes away. One of our big, wonderful things that happens is if we get a locums who says, you know what, we like it here so much, we want to stay. And that makes our day every time. And so we're very quick to say, hey, if this works for you, this is working for us. So that's a wonderful day. I know a lot of the locums companies are like, oh, don't take our good locums, but sometimes it happens and they just want to stay. And that really, to us, that's one of the biggest compliments we can get, that locums who was worked all over the country has decided they want to stay home and come with us at Wellstar.
Yeah, it's a good indicator you're doing something right, Jana?
Absolutely.
Yes, thank you so much. Jana, can you build on sort of some of the comments or react to what Janet and Francie have said?
Sure. I'll start with just that last comment that Janet made. And I think as we partner with organizations like Wellstar, those physicians choose to stay because of the experience. And so Janet and them have absolutely figured out how to onboard physicians and the importance of that in the way that they bring them on, the way that they orient them within the practice, the way that they support them in their efforts while they're there as a locums physician. And so that onboarding makes such a huge difference as locums come in and out of facilities all the time. And so being able to integrate them into their culture allows them to see what a facility like Wellstar is like, and makes them want to look at that as a permanent offering. So that is the win. When they come in and want to stay, that is the win. It serves both purposes for the facility. So certainly that is a number one way to fill the gap from a permanent perspective. The other, as Francie mentioned, in conjunction with each other, that's very much a strategy that we too internally are working through to be able to get closer to how we can make that happen. Not all locums physicians want to go permanent, but we can fill the gap while we search for a permanent physician. It's got to be a short-term, long-term initiative working together. So very much echo the two ladies and their strategies that they have.
For sure. Thank you, Jana, for bringing your perspective to that question. I want to move now to another trend that's sort of important in this space, which is of course increased utilization of advanced practice providers versus physicians. This being leveraged as a tool to optimize the workforce, reduce reliance on locums, but I imagine also give that added support to permanent physicians as well. Can each of you sort of talk about this trend, how it's showing up? Jana, want to start with you since you have sort of a high level view here as seeing this play out in different parts of AMN. So if you could kick us off, that'd be great. Sure,
absolutely. It is an absolute growing trend, and we see it year after year continuing to grow. If you look back at our AMN physician survey, back in 2016, only 8% of our locums coverage was coming from APP providers. This year in 2024, that is now up to 24% of locums is now covered through APP. So when you look at the shortage, when you look at our ability to really take advanced practice practitioners and fill the void, that is becoming strategic across health systems in any place that we can move those physicians around. So it is absolutely a growing trend and continuing to be something that's helping to cover the physician shortage gap.
For sure. Curious too, if you could, Jana, go a little bit deeper there. Like, what are the characteristics of organizations that are really figuring this out, doing this very well, or how are you approaching it? What are characteristics of when this strategy is very effective?
So our strategy as of late is we are really pulling those two together, where we are most physicians or positions where they can utilize both a physician or an advanced practitioner. We are working that together. So we will open up the opportunity for both a physician, but just as the locums and perm kind of running the same lane, we are doing the same thing with advanced practitioners. So we will open up a need also for an advanced practitioner, and then we will fill the void however we can. And so we are really taking that type of an approach to pull those two models together as well, and making sure that however we can provide the coverage we are, whether it be through a physician or through advanced practice, if the facility can support that.
Right. Thank you, Jana. Janet, coming to you now, how are you thinking about this?
Our APPs, they are such the future of care in the world of healthcare. Allowing APPs to practice at the top of their licensure, it will help us all and at the end of the day, because the APPs now, there's so much they can do. I think about our PAs who are in the ICU. I think about our nurse practitioners who are out there in the primary care practices, and them practicing at the top of that license. It's providing care to patients who may not have otherwise gotten it, but it's also really extending that physician to being able to care for more folks. And so we utilize our APPs as much as we possibly can in all of our service lines. Very strong leadership on our side with our APPs. And they have, we don't use a lot of APP locums because we're very fortunate in the Atlanta metro area to attract a very large, well-qualified group of APPs. But when we do, we've been able to find some very strong APPs who have come in to work with us. But APPs really are going to be the future as that physician shortage continues to grow, and as we continue to really help educate and train the APPs in healthcare.
Yeah, and you mentioned that you believe this is really the future here, and I'm sure many believe the same. But I also intuitively just know that there can be resistance to change, generally speaking, as an observation. Is that something you've perhaps encountered with this trend? And if you have, how have you sort of navigated that hesitancy?
Absolutely, it is something I've encountered in my career. It absolutely is. In the beginning, when nurse practitioners and PAs first really started, they were just seen as an extension of a physician, and they have evolved so much over the years and have proven to be truly a partner to that physician that they work with. And so it's been exciting to see that transition. There still are pockets where some of the physicians are like, no, I've got this. And so, but we really do try and work with them and help them see the value and how this can really help with caring for our communities.
Yeah, that's fascinating, pointing to the value and then pointing back to the community to generate that buy-in, right?
Absolutely, you're correct.
Yeah. Francie, what's your assessment here? How are you thinking about this trend?
I mean, as an organization, APPs are part of our care teams. We have real strong leadership for our APP providers. And as Janet had mentioned, it's been a process, but it's a process that's working. I would say as far as locums goes, we have an increased utilization of APPs every year with, I'd say, the biggest increase last year, specifically CRNAs. I mean, in the last year, we've had a very big impact of anesthesia in general, but CRNAs has been a big part of that, those locums that we have hired to support our sites.
Certainly. And I appreciate you weighing in as well. And we're going to do one final question, closing thoughts question, before we get to some audience questions. And we've got a good queue built up to work through. So excited to get to some of those. But to start, before we get to those questions, is there anything we didn't cover today you want to flag for attendees? Any final thoughts you want to share? I kind of leave it to you how you want to leave folks with the end of this panel discussion. Francie, I'll give you first swing at this one.
I think as far as locums goes, I think the landscape of healthcare is changing over the past 5 years. We've seen a big change. And as a company, what we've done is we put a strategy instead of like saying, let's hire locums only if you need it as a last resort, and then there's no strategy around it. We've identified, prioritized locums, and we have a strategy around it, when to use them, how to use them, how long to use them. And it's really benefited us in so many different parameters. I think it's an area we can always do better. There's always areas that we try to improve the process to make it as smooth as possible. And onboarding is one of those things that is so integral into that, introducing that provider to the site. We have over 145 hospitals and over 2,200 medical groups. And so, I would say it's sometimes difficult to have a process at all those locations, but I think we've done a pretty good job of it. And it's really putting the spotlight on locums and being able to share information of how we're using them and the trends and the strategy behind it.
Yeah, certainly. And excited to be able to have pulled out some of that experience for our audience today. Francie, thanks for your contributions thus far. Janet, let's move to you. What are your closing thoughts?
Absolutely. I echo what Francie said. One of the keys is really knowing when to use locums, right? Knowing who to partner with to get the best locums, but also really when you bring in that locums, to have them be onboarded and welcomed to your system and to the practice where they're going to be, because that helps them with, hey, I'm here, I've got what I need to practice medicine, to take care of folks. But also locums is a very small world. And so a lot of folks talk a lot, I had a great experience here. I didn't have such a great experience there. So one of the things we really do strive for is providing an outstanding onboarding experience for our locums, knowing that we need to use them, and we need to make sure it's the best scenario possible.
Yeah, makes a lot of sense there. Got to have that strong onboarding so they can have the impact you want them to have. Appreciate that, Janet. Jana, you want to take us home with some closing thoughts here, and then we'll get to some audience questions.
Sure. I think as we look at the future forward, this particular model around physician recruitment and locums physicians is not going away anytime soon. The physician shortage is, as Pat mentioned earlier, is here to stay and just continuing to get more strained as we look forward. And so as the women said, being able to strategically partner when you know you need the coverage and how to utilize the coverage is critical. And then as Francie mentioned earlier, data is key. So as you know the utilization, as you know where you continue to have the need, those are places where strategy can be built to really help support that cost containment, but also looking at the opportunities for us to really support in a more meaningful way than just one opportunity locums need. And so as you think about locums, as you think about your contingent workforce and how you do that, it's just critical to have a partnership that really allows the strategy to come together. So.
Yeah, a strong place to finish on our panel discussion. Jana, thank you so much. And thank you, Janet. Thank you, Francie, as well. And Chris, appreciate your contributions when he was on a bit earlier. I know he had some technical problems, but appreciate folks bearing with us through it. Hope he really found value in our conversation today. We're going to now move to the Q&A portion of our webinar. And as a reminder, you can enter in those questions in the Q&A chat box, and we'll get started here. We've got a bunch of great questions. Really appreciate this kind of engagement from our audience. The first one's a little bit of a longer one, but some good context setting here in this first question. So the attendee asks, according to the research, only 11% of providers working locum tenens are primary care physicians, family medicine, internal medicine, pediatrics, down from 21% in 2016. Demand for primary care locum tenens physicians has decreased in recent years, while demand for specialist physicians has increased. How do we increase the locum pool in primary care if there's a mass exodus approaching? So easy one to start. Who would like to take this one?
I'll start. Absolutely the case. And I think this goes very much hand in hand with one of the topics we had, but is in that APP space. So as those physicians are really leaning into specialty related increases there, we absolutely have to utilize APP to fill the void for family practice, because that population is decreasing even in the locum space from a physician supply.
For sure. Janet, Francie, any additional thoughts from either of you?
I would agree. We use about 15% of our locums are in the primary care field. Most of them are more hospital specialties, but we're seeing an increase, I would say, of APPs to support that shortage of primary care.
Yeah, certainly aligns with that theme of the conversation that's been coming out.
Mm-hmm. Mm-hmm.
So next question is the attendee would like to hear more about how outcomes are impacted or affected by a heavier reliance on locums. Does anybody have some insights there?
I can jump in just from an agency perspective. I mean, we certainly don't we're not at the bedside. We don't see the outcomes from that perspective. Although from a locums perspective and from an agency perspective, we carry their medical malpractice insurance. And so the vetting of locums physicians is very stringent. So we are looking at all of their credentials, ensuring that they are, at the very top of their game going into the market. And so we very much care about the outcomes because we cover their insurance. And so we have a very stringent quality control in place, clinical, that reviews candidate provider concerns if we happen to get them back. And so we partner with facilities, with medical staff offices to make sure that we are very much a part of what that quality looks like going into the facilities, so that there is no outcomes that neither of us would want to be associated with.
Yeah, you're completely incentivized in this to make sure that the outcomes are coming the best. Yeah.
We absolutely, we care as much as the facilities do relative to outcome.
Mm-hmm. I mean, something I can add too is to that question, because that's so important, is what we've been trying to do is vet candidates up front a little bit more. About 2 years ago, we put in a new process where we wanted all that information up front. We do a bid process. And so all the malpractice, all those issues, we vet up front. And so before even providing our clients at our facilities, locums that have been presented to our job, we try to identify all those issues. And it's really significantly cut down on, I would say, issues that we have at our facilities.
Appreciate you adding that in, Francie. Want to move to a next question now. We've got a ton of great ones. Really appreciate, again, this engagement from folks. The question is, and Janet, this might be a good one for you to tackle because it sort of came up towards the end in some of our conversation, but the attendee asked, what does locums orientation and onboarding look like, and what are some best practices?
Sure, absolutely. With our locums, we require our locums to go through our orientation regarding all of our policies, all of our expectations, because locums are representing Wellstar Health System when they are working with us. So we expect them to know how, our code of conduct, how we expect them to treat our patients, how they work within Epic, et cetera. So we make sure they have that information on the front end as part of it. Most of them have like a day-long orientation where they watch our videos, they do quizzes, they make sure that they have met that. And then when we get a locums who is ready to come on site, there's someone from the practice who meets them that day and says, welcome, glad to have you here, helps them get their badge, helps them sign into the computer system for the first time, introduces them around. Usually our physicians will give them a tour. If they're working in the hospital, they give them a tour of the hospital and introduce them around so that they know right up front where to go, what to do, who to ask for. But you have to be very proactive. You have to let them know up front what is expected. We hold them to the same standards of care and the same standards of behaviors that we do our employed physicians.
Mm-hmm. Thank you, Janet. Francie, Jana, anything to add or build on there?
Yeah, I agree everything with Janet said. That onboarding is crucial. And setting those expectations, and I preach this probably more than I should, but at the end of the day, I think our positions are very transactional, but we impact patient care directly by that physician that we bring in, or the APP provider that treats our patients. And we have to be so mindful of that process. And anything we can do to enhance that process, I say that is our job to do. Because at the end of the day, they do treat and touch and care for our patients.
Certainly. Thank you, Francie. Jana, did you have something to jump in here with too?
No, I just echo them. I mean, the experience and the onboarding of a physician makes that placement either a positive placement or one in which they may not choose to return because it is so important in the way that they are onboarded and just brought into the culture of the facility. And so, you know, physicians have options, and in the locum space, I mean, that is one of the things that is a benefit of doing locums is they do have the option to move about. And so having a locums come into a facility and wanting to stay and extend their time there is, you know, probably very contingent on how those first few days and weeks start with the assignment. And so it is critical, especially when you're looking at continuity of care.
If you want that scenario to play out in your organization, it stands to reason you better get the onboarding right. If you want those folks to stay along. The next question here gets at something we touched on quite a bit during our conversation, but I'll still pose it to see if there's anything any of you three would like to add, which is the attendee asked just what are you seeing in the market with locum and CRNAs, NPs, PAs? Anything additional to add that maybe we didn't cover or anything you want to reemphasize?
I mean, I'll just add from an agency perspective, the CRNA space is absolutely our highest demand space right now from an available request from our clients. That market is really at unprecedented heights for the need for CRNA. And so the good part for us there is the supply in the CRNA space looks better than in the physician space or the doc space for anesthesia. So while we can't cover every opportunity, we are having better success in helping and supporting organizations across the United States in a much more meaningful way in that space. But it is absolutely a concern, the amount of demand that is in that space. I don't believe it's a sustainable model either.
Right. Francie, Janet, anything to add there?
I was going to echo what Jana said. CRNAs, wow, it is the most high demand. And in Georgia, we're able to use AAs as well. And so that is the most in demand specialty. I've seen it over the years, but I've never seen it like this. So, and the thing is CRNAs and AAs can write their own ticket. They can go wherever they want. So when you're fortunate enough to get good CRNAs and AAs to come to your institution to work in your ORs and your ambulatory surgery centers, you have to make sure that you treat them well and really show them, here's what we have and here's how we can all work together, because they can, as Jana said, they can go wherever they want on a daily basis.
Certainly. Appreciate the additional commentary around that. Let's move now to the next attendee question, which is there an opportunity for non-clinical healthcare professionals to support locum strategies? Any thoughts from the group on this
one? I'm not sure in what category that would be. Right now for locums, we are hiring all clinical.
Yeah, I mean, I think the only place, Francie, where maybe non-clinical could support is in that onboarding. So somebody who is there to help onboard, to help orient, somebody that's there on site in any facility that has a locums request or a locums coming in, maybe that would be a place just in that transition. Maybe that would be the only place that I could feel like non-clinical could support us, but maybe there.
Yeah.
That's a great call out, Jana. Thank you for that. We'll move now to our final audience question, which is the attendee asked, what tips do you have for centralizing locums? What are a few key questions that should be asked? What are the thoughts here from this group?
I can say for us, it truly was a game changer, creating a standardized national program for locums. Just overall as a system, when we identified locums as the first specialty to standardize across CommonSpirit, we had with one vendor, we had over 90 contracts. because every facility would have a contract. So standardizing it, we have one contract with our vendors, and then we have a VMS, and there's a process. It's very streamlined, it's very simple and easy. So it took a lot of the chaos out of the locums process. And then being able to, all the benefits of the partnership, I want to say, people always say, what do you mean by partnership with a vendor? And I probably didn't understand it when I first got into this field, but it is crucial too, because you can talk about real times, and the vendors want to help you as much as you want them to help you. You know, a true partnership is working collaboratively together to place that right physician in that right facility, and if there's issues, resolving it in real time. You know, I mean, that's true partnership. Locums are expensive, and we all know that, and our spend is increasing, and I think everyone's is how do we control that? How do we work with our partners in collaboration? Like Jana said, this locums to perm option, you know, is constantly pushing the envelope and always trying to make it better. But I can say to your original question, I got off track there, but having a standardized program has been, it's very simple. It's like a plug and play.
Yeah, and to echo Francie, when you have one point of contact for a system for locums, it absolutely is a game changer. One contract, everybody's working off the same set of expectations. You know, our credentialing expectations are this, you know, please only send candidates who meet our criteria. But also it really does bring everybody together so that we know what's going on in the system, because when you've got practices doing their own thing, there's no control. And so it's a huge benefit for the system by having it centralized.
Jana, anything to add from you?
No, I completely agree, and that just containment is critical for understanding utilization, understanding your strategies, understanding how to take physicians in your own network that you have, whether on a locums basis or float pool or whatever that strategy looks like, and being able to utilize them across your system. When that is fragmented, it is very difficult to get your arms around that. So being able to pull that into some type of a program or a technology or a partnership to be able to contain it, I think makes all the difference in the world.
Certainly. Well, Jana, I appreciate the time. Janet as well. Francie, of course, thank you so much. And Pat, thank you for your contributions earlier. And apologies, I may have confused his name on an earlier reference. Sorry about that. But attendees, thank you so much for the great engagement in this wonderful conversation. It really was a privilege for me to be able to be a part of it. So thank you to AMN as well, Language Services, for sponsoring today's webinar. To learn more about our conversation today, you can check out the resources section on your webinar console and fill out the post-webinar survey. We appreciate that. Thank you one more time for joining us. We hope you have a wonderful afternoon.
Thanks, Brian.